I'm Brigadier General Kathleen Flaherty. I'm the Executive Director of the Marcus Institute for Brain Health here on the CU Anschutz Medical Campus. I'm so excited to share with you what we do and where we do it. And one of the things that I love about where we do this sacred work is it's on CU Anschutz Medical Campus, which the center of this campus was built on Fitzsimmons Army Base. And so the foundation of what we do here is really to give back to our veterans, our first responders, and our service members. And so these facilities where we see and treat these patients are temporary barracks, 1947 temporary barracks, but there's something home about it for the people who come here. And two of the other things that I think are really interesting about where we provide this care is Colonel's Row. Colonel's Row is, we converted 2 Colonel's townhouses into lodging for our patients. So within Colonel's Row, there's 11 bedrooms and 8 bathrooms. But more importantly, there's that common space for our patients and their cohorts to come together, to cook together, to mentor each other, to be there, shared experience. And for some of these cohorts, they've stayed together years afterwards because they've given them that sense of community where they've lost in other environments. And each individual patient gets assigned their own patient room because we know what we're asking them to do is challenging. 32 hours of treatment in a week is a lot. So each of them gets their own computer room where they can have individual downtime that they can decompress. We also have this patient lounge, and in this patient lounge there is weighted blankets, there is meditation chairs, there is weighted vest, and these 2 stuffed animals, this panda and this bear, are weighted and known as anti-anxiety bears, and just holding them helps our patients down-regulate.
When our veterans and first responders come to us, we ask them what their priorities are, and then we will evaluate and treat them with their priorities in mind. And most importantly, we will look at cognitive communication deficits, including memory, attention, speed of processing, and higher level problem-solving difficulties that they may be having at home, at work, school, or in their community.
What we like to do with our patients here at the Marcus Institute is take a all-encompassing review of how they're functioning from a vision or ocular motor perspective, a balance perspective, coordination, sensation, and their neurologic functioning to see, one, how each of those systems themselves are working, as well as how their brain is able to take each of those pieces of information and combine it to make sense of the world that's going on around them, but as well as how they're able to interact and engage.
I see patients when they come through our evaluation program to look at their post-traumatic stress, depression, anxiety, emotional functioning, as well as their cognitive functioning, so their memory, attention, processing speed, and look to see how they're functioning on testing and how that might impact their day-to-day life and their quality of life.
Sometimes a mild traumatic brain injury can actually impact in a negative way. Part of the networking in the brain that's responsible for communicating and verbalizing feelings. Art therapy offers a way to allow people to express themselves non-verbally. So when it's difficult to talk, or when it's difficult to process emotional material in a verbal way or a language way, the arts offer an alternative visual language, a creative language for them to be able to express where words fail and learn about themselves and allow others to get close to them.
As we look to the future, we're not looking towards just adding years to their life. We're looking at adding life to their years. Individually and collectively as part of the Avalon Action Alliance, I'm so excited about these continued and even growth of our partnerships and collaborations. Thank you.